You know, car accidents, bad falls, gunshot wounds, these are the moments that push the human body to its absolute limit. But what really happens in those critical minutes and hours right after? Well, we're about to dive deep into the high-stakes world of traumatology, the incredible medical science of what it actually takes to put us back together again.
So, at its core, traumatology is the science of emergencies. And look, we're not talking about a sprained ankle or a minor cut here. We're talking about severe, life-altering injuries that demand immediate expert care. This is medicine under the most intense pressure you can imagine, where split-second decisions can literally define the line between life, death, and what recovery looks like long-term.
To really get a grip on this, let's make it personal. Let's say you've broken a bone. It's a pretty common injury, right? But what happens next, both inside your body and in the hands of a doctor? That whole process reveals the core principles of traumatology. So let's take a journey through the body, and we're going to start from the top. All right, first stop, the upper body. We're going to look at one of the most frequently broken bones there is, the clavicle, or as pretty much everyone calls it, the collarbone. It's a perfect and surprisingly complex place to start to see what happens when bone meets force.
I mean, this injury is incredibly common. The collarbone actually accounts for about 4% of all fractures. You see it a ton in young, active people. Think cyclists, skateboarders, you get the idea. And it usually happens in that classic way. You fall, you stick your arm out to catch yourself, and that shock wave travels straight up to your shoulder. Snap.
Okay, but here's where it gets wild. Right after the bone snaps, it's not like the pieces just sit there. The break instantly becomes this biological tug of war. There's a powerful muscle in your neck, the sternocleidomastoid, that immediately starts yanking the inner piece of that broken bone upwards and backwards. And that's only half the battle. On the other side of that break, you've got the huge weight of your arm, plus your main chest muscle, the pectoris, pulling the outer piece down and in. So you see the problem, right? This is the core challenge for the doctors. Your own body's muscles are actively pulling the broken bone out of alignment. So, how do you fix it? Well, there are two main paths. If the break isn't too bad, a simple arm sling can hold everything still enough for your body to just heal itself. But if those muscle forces have pulled the bone fragments way too far apart, you're looking at surgery. They do something called an open reduction internal fixation. Basically, surgeons go in, they physically put the bone back in line, and then they lock it in place with metal plates and screws. Okay, so from the common collarbone, we're now moving to the body's core. And this is where fractures enter the danger zone. We're not just talking about a broken bone anymore. We're talking about a direct threat to life itself. We are talking about the pelvis.
Just look at this number. It's staggering. For what are called open pelvic fractures, that's where the bone actually breaks through the skin, the mortality rate can be as high as 50%. It is one of the most lethal injuries a person can possibly sustain. And the reason it's so deadly? It's not just about the bone. It's about the colossal, unbelievable amount of energy it takes to break it in the first place.
See, that immense energy doesn't just stop at the pelvis. Oh no, it radiates through the entire body, causing catastrophic damage everywhere else. I mean, think about it. In over 60% of these cases, the patient also has a major chest injury. Half the time, other big bones like the femur are fractured too. And in 40% of cases, there's a severe head or abdominal injury on top of it all. It becomes a total body crisis, all sparked by one single devastating impact. All right, let's move down the body to the lower extremities. This area is home to some of the most intricate and challenging fractures to repair. Seriously, these injuries can be like trying to solve a three-dimensional jigsaw puzzle, where all the pieces are made of bone.
A perfect example is the pylon fracture. This is a severe break of the tibia right where it forms the ankle joint. And this is not a clean snap. It involves two really destructive forces. First is something called impaction. Picture a car crumpling at a head-on collision. One part of the bone is just driven forcefully into another. Then you've got comminution, which basically means the joint surface shatters into a bunch of little pieces, like a dinner plate you dropped on the floor. The tissue all around it is devastated, and the long-term risk of arthritis is sky high, because surgeons are faced with the nearly impossible task of gluing that shattered plate back together perfectly.
So we've looked at a common break, a life-threatening one, and a really complex puzzle. But here's the thing. Despite all their differences, the approach to healing every single one of these fractures follows the same fundamental principles. This is the universal road to recovery. And it all comes down to a really simple framework for healing almost any fracture, the 3 R's.
First up, reduction. Whether it's done by hand or in an operating room, you have to put the bone pieces back into their proper alignment. Step 2, immobilization. You hold the bone perfectly still with a cast or internal hardware so the body has a chance to build a bridge of new bone across the break. And finally, rehabilitation. Once it's healed, physical therapy is absolutely essential to get back your motion, your strength, and your full function.
You know, from the simple snap of a collarbone to the devastating shatter of a pelvis, the science of traumatology is this constant dance between fragility and resilience. It shows us just how easily we can break, but it also reveals the incredible systematic power of the body to put itself back together. It really leaves you wondering, what does this remarkable science of mending bone truly tell us about the limits and the amazing potential of our own bodies?